Breast cancer screening. What is cancer? And what is a cancer screening? Cancer is when the cells in our bodies go wrong. Cancer causes growths or lumps in the body. We are going to talk about having a cancer screening. This means a special test that you can have to make sure that cancer is found early and to get treatment as soon as possible if you need it. Breast cancer is more commonly found in women. Women that have family members that have had breast cancer might be more at risk of getting it. This is why it is important to feel the lumps in your breasts and check for changes in the way that they look. It is also important to go for a breast screening when called for a mammogram once you are invited for one. A mammogram is a picture of the inside of your breast. It is not possible for people who are registered as male to have a mammogram as part of the NHS breast screening programme, but your doctor can refer you if a mammogram is needed. You will be invited for your breast screening by a letter in the post. The letter may say that you have to call the screening office to book in a day and time for your appointment. If you don't understand the letter, you can ask someone to help you to read it. You can let the screening office know of any adjustments that you need. This could be explaining that you are a wheelchair user. You can ask for a longer appointment. Tell them if you need support from your carer. You can let them know if you are very nervous. Tell them if you need an interpreter or if you have any disabilities. Depending on what might be best for you, the staff might book you an appointment at the hospital breast screening clinic or a mobile unit, which could be in a local car park near you. Going for your mammogram. On the day of your appointment, make sure that you arrive on time or call ahead to let them know if you are running late and need to reschedule. Make sure you bring your appointment letter with you. This is very important. When you arrive, show the staff your appointment letter and they will check you in. The staff will explain what is going to happen. You can ask them to use simple language and short sentences. Let them know if you don't understand something. You can also let them know if you're worried about anything or if you have any questions before your appointment starts. Getting ready for the scan. You will need to undress the top half of your body. The staff will explain what to do and what is going to happen with the equipment. The scan is normally done while you are standing up, but it can be done seated if needed. Try to relax. You can bring someone with you to support you. Having the scan. Once you are ready, the scan will start. It will take photos of your breasts. The staff might ask you to move into different positions to take different photos. They may need to touch your breasts to get in a good position for the photo. The scan can feel uncomfortable and can be a bit painful for some people, but it should be over quickly. Let the staff know if you need to stop or if you have a question during the scan. It is really important that you have your breast screening so that changes in your breast can be spotted early. If you have any questions after the scan is done, please ask the staff before you leave. Getting your results. You should receive a results letter in the post within 2 weeks. If you are worried that you haven't received the letter, you can contact your doctor's surgery to see if they have the results. If there is something found on the scan that needs more tests, your results letter will explain what to do. If you are unsure, you can ask someone to help you read your letter. If the result is normal, you will be invited for another mammogram every 3 years. If you are worried or have any questions, you can get help from your carers or contact your local learning disability team. If you have any problems with your appointment, you can also speak to your local learning disability team.